Hi, I'm Maggie from Maggie in Retirement. Are you getting ready to go on to Medicare? Are you wondering what your premiums are going to be and if they're going to just skyrocket over the years? Well, let me tell you how it's been for my husband since he went on Medicare at 65 in 2023. And then at the end of the video, I'll tell you what we're going to do in the future. So this is based on, he was 65 years old when he first started on Medicare, a male, and we're in California. So rates in different states are different. These are just the numbers based on our situation, and I think our zip code goes in there somewhere also. So we took the Plan G, and here's the Plan B for Medicare that everybody pays. And in 2023, the monthly premium $164.90 and a $226 deductible. 2024, it went up to $174.70 with a $240 deductible. And then in 2025, it is now $185 per month with a $257 annual deductible. And on Plan G, you just pay that, and then if it's covered by Medicare, everything is covered for the rest of the year. Okay, so when he started in March of 2023, he had a new to Medicare 1-year discount. And so his premium was $145.10. Okay? Then in March of 24, when he turned 66 to May, the premium went up to $162.10. So he lost his new to Medicare discount, and then he had a little bit of a bump because of age. So the difference of this is 11.7%, 11.7, 11.5 in there somewhere. Then in June of 24, they have their annual increase from the supplement plan, and that's everybody gets raised up at that time. So there it went to $181.10. No, 41. Sorry. 41. Okay, so almost a $20 a month bump for the annual premium. This was 11.7%. So this was 11.5, and then this was 11.7 from here to here. Then in March of this year, because he turned the next age up, it went up his premium to $189.62. Okay. Then in June, the premium, we're currently in the end of March, but I've got an annual premium notice from them. So in June 25 until February of 26, the month before he turns the next year up, the premium is now $217.97. $89, $99, $09, almost $30 a month. Okay, then in March of next year till May, this was included in the annual. He's aging up, so his rate is going to go up a little bit, and it's going to $227.40. And then there'll be a new one for June to February, June of 26 to February of 27. The annual will be down there. So we've gone from $145.10 in 2023 when he went on Medicare to $227. So this was a 14.5%. This was, the age here was 4.5. And then this annual premium is 14.5, and then this will be another about 4.5%. and then it keeps going up every year for age up, I think for 10 years, and then it maxes out. So I guess you're getting a discount every year up until you turn 75, I guess. And this age thing is for this company in California. So we're a birthday state, and we're not community rated. I think community is everybody pays the same no matter what age you are. In California, you get a little bit of a break, but then it goes up every year for 10 years, and then it maxes out. And then that's where you'll be. So, now we get on to what are we going to do for the future. So I'm going on Medicare in May. They told me that my rate will be $129 and some change. And that included the new to Medicare, and then also there will be a household discount. So this number did not include the household discount. I don't know if they only give it off of one person or if each of them goes down. This will be new to us. So I can update, I'll keep track and update in another video what happened to the premium if his went down because we have two people in the same household. I don't know. I'm thinking I need to budget for 20% increase in these healthcare costs. This is about 6% here each year, and then this is about 14 and a half. So I guess like 20%, right? Is that what I need to budget? So if you're going on Medicare and you were wondering what's going to happen to your premiums, that's what happened. So, and I did price I priced all the companies thinking that what's going on from here to here. For my husband, I don't want a company that's just going to, give you this in the beginning and then this in, 2 years later. This company was still the cheapest. So they've all gone up. And the difference between the Plan G and the Plan N for us was only about $10 a month. Now, if you're really healthy for 5 years, that's $600. So, maybe you have a couple of co-pays to go to the ER or something after that. But if you don't use it for 5 years, you're saving all that $600. So maybe the Plan N is the way to go to save a little bit. But in my husband's case, he has some medical things going on to where he actually uses his, this is already gone. He used that up right away. So to not have to pay for any other co-pays for specialists or, if there's an ER visit or whatever thing that they're doing, I don't think too many doctors' offices do that that thing where they pay where you have to pay the excess fees. Because when I go online and I look in the doctors I look up, I'll say they don't charge for the excess fees. So I don't think that's something you need to worry about. But if you have ER visits and that kind of thing, then maybe you have to kind of look at what your total costs are going to be. So, and being that we're in a birthday state, so we can change from our birthday to plus 3 months. So my husband's birthday is March, mine is in May. So we could both switch over to another plan, or we can each have a separate plan, whichever one's going to work for us. Still a Plan G, but with another company, if it would be cheaper. And there's no underwriting. And in California, there will also be no underwriting to go from a G to an N. So if the amount per month gets to be bigger in the premium, the spread gets to be bigger, then I'm going to keep reviewing and monitoring and seeing if it might be cheaper to go with the Plan N. So we're not totally locked into this Plan G, which that's what I thought when we signed up. And I thought, dear God, what do you do? And, it's like, why can't you make a change? Things change in life, but no. So we can go from a G to a G or a G to an N, or I can go also to an Advantage plan if I wanted to save money. So, but comment below if you've been on Medicare for a while, is this kind of how your premiums have gone up? Or maybe I'm need to still do some more research. But put a comment below to kind of help people coming into Medicare to see if that's something that, there's maybe another company or another, something that I'm missing here. And so I will be reviewing all the carriers annually. And I will also be looking at the Plan N versus the Plan G rate. And the one thing also that I did not include in here is the Plan D. So my husband was on a plan. It was WellCare, and his premium is currently at $17 and some cents. Like I'm not sure, $17.80, $17.40, something like that. But I went and I checked all the companies, and being that I take one medication, and it's just a generic, doesn't cost very much. And my monthly premium with another company, it would have been the same for me with WellCare, the $17. But I went with Cigna, and it's 80 cents. So I'm going to be checking that every year also, because, I could end up needing, who knows, heart medicine. I could get cancer. I could, I guess, develop diabetes or something. So you have to keep reviewing that. And I think you're stuck on the plan that you're on for the year. So if something were to come up for me in May or June or July, I'm stuck until the end of the year with whatever plan I picked. So if I need, some huge amount of medication, then I will have to be paying the deductibles and the copays and the max out of pocket and whatever, and then I would just review and see who's the best deal for next year. So that's about it. Thanks for watching. If this was helpful to you, hit me a like so that I know. I'll continue to update and give you updates on if my husband gets a discount, being that we're in the same household. So stay healthy, stay active, and I'll see you in the next video. Thanks for watching.